has not reached Mississippi as of yet, Dr. Quinn.
Well, it's not been documented in Mississippi yet, but so far the CDC is advising all medical providers to be on the lookout. They're trying to set up what's called a surveillance system so that we'll be alert and aware that this is a possibility. So far, it's been reported in 14 states, and over 100 children have been affected. Just recently in the state of New York, Governor Cuomo, he reported that 3 children have lost their life. So this is something that's very serious, and the CDC is working very hard to update us to help us understand how important it is that we report this to our local state health departments so that we can keep up with the numbers and really be aware of what's going on.
Now, this is not an upper respiratory disease, from what I understand, like COVID-19 is. This is an inflammatory syndrome. Is that right?
This is correct. I mean, it's a lot like Kawasaki disorder, which is a disorder that's been around for a long time. It's an inflammatory disorder. But what's very puzzling about it is it's uncertain. I mean, basically, Dr. Fauci, the White House advisor, said that this is a very troubling situation. The scenario involves children going to emergency rooms, not knowing that they had the COVID infection, but they may have fever, red eyes, skin rashes, abdominal pain, nausea, vomiting, and a very low blood pressure. And what they're determining is a lot of these children have this inflammatory disorder affecting also the blood vessels, including the coronary blood vessels going to the heart. And some of these children are going into heart shock or even heart failure. And this can be very dangerous. And as I said earlier, some children have lost their life.
So what do parents need to watch for? What are some of the early signs of this, Dr. Quinn?
Well, the deal is parents just need to be aware. And during this time, a lot of parents are afraid to take their children to the emergency room because they don't want to expose their children to potential of other people there who have COVID-19. But the problem is children that have this syndrome that's being associated with COVID-19, because a lot of these children are coming back with positive antibodies, or even some having positive tests showing that they either have or have had COVID-19. But they don't have the typical respiratory symptoms. So what the CDC is advising and urging is that all parents not delay. If your children have fever, symptoms of abdominal pain, nausea, vomiting, especially respiratory or even chest pain, don't delay. Call 911 if you can't get them there very quickly, but don't delay because they could have this syndrome that could potentially be deadly.
I guess with everything else, we don't need to drop our guard yet then, do we?
That's correct. Let's not drop our guard. It's always best to be safe rather than sorry, especially for our children.
Yeah, especially kids. Dr. Quinn, thank you so much. I appreciate you dropping in like this and keeping us informed.
Hey, thank you.